Welcome to Community Health Briefs, where AI hosts share short, clear stories about research shaping healthier futures. Each episode highlights new work from members of the College for Community Health at Montclair State University, showing how ideas connect to the social and structural forces behind health. In short, this is research you can trust, explained by AI in minutes.
Today, our mission is really to shortcut your understanding of a pretty critical question in community health.
Yeah, we're asking, are these big federally funded marriage and relationship programs actually working for everyone they're supposed to help?
Exactly. We're diving into a recent content analysis, and frankly, it suggests there might be a profound structural mismatch going on. We're leaning on the work of Dr. Brad Van Eden Moorfield. He's a family science professor, studied diverse couples for over 20 years.
Right, and also Dr. Elvis Guyon, who is the director of health equity over at the American Psychiatric Association.
So really respected researchers in the field.
Definitely. And what they specifically looked into were these healthy marriage and relationship education programs. You'll hear them called HMRE.
HMRE, right. Funded by the federal government.
That's the key.
Yeah.
And they focused on programs aiming to help Black and African American participants. So the researchers asked, are these programs, which, let's be honest, are often built on sort of mainstream Eurocentric ideas, are they just completely missing major stressors? Things like systemic racism or ongoing economic hardship.
Okay, let's try and break that research question down really simply. Most relationship help focuses on the internal stuff, right? How you communicate, how you argue. But are these specific government-funded programs also looking at the huge external things, the structural barriers?
Yeah, like racism, serious money worries, maybe unstable housing, things these particular couples might be facing every single day.
So how did they figure this out? What was the approach?
Well, interestingly, they didn't look at whether couples stayed together. Instead, they analyzed the design of the research studies themselves.
Ah, okay. So the study's evaluating the program.
Exactly. They did a content analysis of 39 different efficacy studies. These were all funded by the Administration for Children and Families, or ACF. That's the federal agency handing out the grants.
Got it. And what were they looking for in those studies?
They coded them based on a few things. Did the study mention a theoretical basis? Did it acknowledge Eurocentric bias? Did it account for class or structural barriers? And crucially, did it seem culturally relevant?
Okay, so let's get to the findings. This is where it gets pretty startling.
It really is.
When they looked for any explicit mention of structural barriers, so things like systemic racism or the specific economic pressures Black African Americans might face, 89% of these studies said
Nothing.
nothing at all. 89%. Just think about that.
That's nearly all of them, basically ignoring the external world these couples live in.
It's a massive oversight. And kind of backing that up, the same number, 89%, also completely failed to acknowledge Eurocentricity. Meaning the built-in bias towards assuming Western, white, middle-class ways of being in a relationship are the only healthy ways.
Right. Which might totally miss things that are really important in other communities, like strong kinship networks, extended family support, or maybe the role of faith. Things that can be huge sources of resilience.
Wow. And it seems like this lack of awareness runs deep. You mentioned theory.
Yeah, this was also pretty striking. 85% of the studies didn't even explicitly state what theoretical or conceptual foundation they were using for their program design or evaluation.
So they weren't grounding their work in any established understanding of relationship dynamics.
Yeah.
Especially not one maybe tailored to the community.
It certainly seems that way. It suggests the programs might just be, a collection of communication tips without a clear, proven framework behind them, especially not a culturally adapted one.
And that cultural piece seems almost entirely missing.
Almost entirely. Only 2.5%, that's just one study out of the 39, included a measure that was specifically designed to be culturally relevant.
Just one.
One, failing to account for things like kinship or faith, which, as we said, can be absolutely vital.
So if we connect this to the bigger health picture, we know things like systemic racism, economic instability, these aren't just abstract ideas.
No, they're recognized social determinants of health. They cause real chronic stress.
And you can imagine if your biggest daily stressor is, say, discrimination at work or worrying about rent.
Exactly. Being told to just use I statements more might feel, beside the point. That external stress, it creates what researchers call spillover.
Spillover.
Yeah, the stress from outside the relationship spills into the relationship dynamics. And often, that spillover has a much bigger impact on stability than whether someone knows the right way to communicate during a fight.
So programs that ignore those root causes,
Yeah.
they're maybe offering what? Temporary relief.
At best, it's like putting a Band-Aid on a much deeper wound, a wound caused by these larger structural issues.
So what does this mean for people actually doing the work, for practitioners?
Well, it strongly suggests a need for some real changes, things like deep cultural attunement training for facilitators.
Understanding the specific context.
Absolutely. And trauma-informed care training, too.
Yeah.
Recognizing that many participants might be dealing with trauma related to these structural issues, creating genuinely relevant and safe program spaces.
And what about policymakers, the ones funding these programs?
The big insight here is that relationship health isn't just about individual behavior. It's deeply connected to structural factors.
So policy needs to address those structures.
Yes, we need policy work focused on actually reducing or getting rid of those class and structural barriers. Think about things like truly affordable housing programs, initiatives tackling systemic racism in areas like hiring or the justice system, addressing the root causes.
Okay, so the main takeaway for you listening seems to be this. For relationship support to be truly effective, especially for diverse communities facing external pressures, it absolutely has to be tailored. It needs to understand the specific cultural context and explicitly acknowledge and address those big macro-level barriers.
Focusing only on communication skills when people are being hammered by systemic forces, it's not likely to create lasting change.
It really makes you think. If these programs don't acknowledge the actual world these couples navigate the economic instability, the structural racism, are they genuinely helping build stable foundations?
Or are they just, maybe unintentionally, offering a quick fix that doesn't last because it ignores the real problems?
It's a tough question. And maybe it leads to another one for you to consider. What other areas of community health support things like mental health services, maybe addiction programs, even nutrition advice, might also be suffering from similar unexamined Eurocentric biases in how they're designed and delivered? Something to think about.
Thanks for listening to Community Health Briefs. This podcast was created with the help of AI, verified by the paper's author, and does not necessarily reflect the views of the College for Community Health or Montclair State University. Thanks again for listening, and stay tuned for our next episode. Make sure to subscribe and check us out at www.montclair.edu/CCHL to learn more about us and the amazing work we're doing for community health.